All right, good evening and welcome to this very exciting discussion. I have a special guest with me, Dr. Praveen Kumar. My name is Coach K. I'm the founder of K-Fit Academy, and I have a real love and passion for sports right from the childhood. And I just got myself uh, into this real magical world of running and fitness, and also in coaching because coaching always provided me a lot of excitement. Uh, and I'm extremely happy today that on behalf of Alert and ALERTATHON, this ongoing 5 days of campaign, the world's first virtual endurance event, which is addressed towards spreading awareness on first aid and CPR skills. ALERTATHON has been a 5 days event, virtual event all over the world. More than 3,000 people are participating, and the entire team, part of the ALERTATHON, and also all the global voice ambassadors. We are very excited to put together an exciting week completely filled with informational session and knowledge building session, at the same time educational topics concerning the very basic fundamental aspect of first aid and CPR. And today, one of these such amazing moments, I'm extremely privileged to introduce Dr. Praveen Kumar with us. Hello, doctor. How are you doing?
Good evening, Coach K. I'm doing fine.
Okay, doctor, you have been an orthopedician, quite a popular doctor, and also associated with the Apollo hospitals for the last 12 years. And I saw that you have an incredible record. You also have worked in the UK NHS for 10 years with fellowship in the USA, Mayo Clinic, and Canada. Your specialization always has been in the sports domain. What brought you into this field, doctor?
Uh, Thank you, Kay, for those kind words. Yes, see, my background training was orthopedics and trauma. And when I was, when I used to treat these patients, of course, we used to, in the UK, we used to have these footballers, professional footballers coming over to our sports clinic, and we had to treat them, get them ready for their games and so on. So that is what started my interest. But what I also found that getting into sports medicine actually made me a better orthopedic surgeon and doctor too, because the traditional orthopedic surgery, so to speak, was more involved in more of bony injuries, less of soft tissue injuries. It was more focused on mending things together rather than actually, thinking of putting the patient back to the playing field. Whereas sports medicine as a specialty is more focused on that, not just, we don't stop just after the patient is healed, but we're all thinking about, is this patient going to be able to go and play the sport back where he started? So I really quite like that aspect of sports medicine, and that's when I thought, yes, I should pursue this further and develop an interest in it.
I really envy your profession because I always enjoyed sports medicine, and also being an engineer, kind of excited to get in the world of nuts and bolts. And if you really see our human anatomy, it's a beautiful engineering. And I think the concept of engineering in physics and the aspect of kinesthetics and the kinesiology. These are some interesting subjects that has evolved over a period of time. So when I came to know that our human body is a wonderful tool for all of us to learn, definitely drawn into this world of magical world of fitness and health and understanding posture and structure and all those things, and of course performance. I'm an endurance runner, so I also like to coach, and this subject always has brought a lot of excitement in me. Then now, one question to you. So you have worked in UK very closely with the sports community. How is it different from working in that kind of an environment back in India? The second part of the question is, do you still engage with sports people, or are you right now an orthopedician, a general orthopedician dealing with all kind of orthopedic issues?
Yeah. So the answer to the first question is it has to, I have to say that it's remarkably different in terms of the type of practice we do in the UK to compared to India. When I moved to India, sports medicine, I would say, was in its nascency, whereas it is quite an established field in the UK. It's still, I wouldn't say, it's getting better in India, that more and more people are seeking specialists with an interest in sports medicine. So that way, it is getting better, and the field itself is evolving. And the other way it is different is the type of sports person and the sports injuries we see. Over there, it was more of football injuries or rugby. Over here, it's probably more of cricket or badminton.
Shoulder.
Correct. And over the years, of course, running community has grown. I would say in the last 10 to 12 years, it has happened in front of my eyes. When I came over, I used to participate in the Chennai runs. Initially the numbers were really low, and every year, they've increased exponentially. So I see a lot of endurance runners and cyclists as well. So that is, kind of evolving here. In terms of my practice, I, I, I am an orthopedic surgeon, but I have a special interest in sports injuries. So that, I think, in a way, it is helpful because sometimes these margins are not very well defined. You may have a sports person with a bony injury, so I have to sort out his bony injury first, and then I go into the sports medicine physician mode where I get him back to his play. So they seamlessly integrate into each other, without any contradictions.
Okay, that's pretty exciting to know that you're able to enjoy what you were doing, what you
Correct.
learned, what you studied, and still have the strong connection with the sports
Yes.
network.
Yes.
Now,
Yes.
I'm going to go back to a little fundamentals. Now, when we talk about musculoskeletal system, so what exactly
Right.
comprises of musculoskeletal system, doctor?
Right. So that's a good question. So the musculoskeletal system, when we to put it in basic words, is muscle and bone. And again, when you call it as fitness, there are a variety of fitness. Most commonly, the divisions, you call it as the cardiorespiratory fitness, which is to do with your heart and lungs, and the musculoskeletal fitness, which is to do with your bone and muscles. And even that is not complete. There is a neuromuscular connection as well. So the brain is also included in both. So when we say musculoskeletal fitness, you talk about generally the muscles, the bones, and the joints, plus the neurological connections. And to put it simply, the best analogy is that of a car that most people understand. When you talk about the cardiorespiratory fitness, you talk about the engine capacity, and all that. When you're talking about musculoskeletal fitness, you're more talking about the chassis or the tires and so on, if that makes sense.
Okay, I think that's a great example. I think a common man can definitely understand that. I guess even heart is considered to be a muscle, and
Muscle, yes,
it is
yes.
definitely, if somebody is into endurance sports, they're not just only developing the
Correct.
muscles which are visible. Let's say your runners for quadriceps and hams and even abs, six packs, something that everybody dreams about.
Right.
Even biceps and big shoulders. And heart is also something that can be developed through exercise. So now, when we talk about exercising, now I've got a very strong understanding of at least developing a good, stronger understanding. I think it's a lifelong learning. Uh, when we can, all of us at any age, there is always this conflict that, okay, as you're younger, you can develop your muscles. As you're younger, your bones can be stronger. As you get older, the muscles are dying, and you need to be careful. Don't lift weight, don't bend down. All this kind of advice it keeps coming from people. Now the question to you is, what is the exercise recommendation? So let's probably divide this into three segments. Let's say the little children, let's say the young adults up to 13, 14, 15, and then the preteen and teenage years. And then let's say the adults, and maybe the fourth one could be at old age. If you can just divide and tell, so what exactly is the minimum exercise recommendation, considering the muscle and bone health? Both are important. I think that's what you
Absolutely.
highlighted, that our musculoskeletal system is really important. That's the chassis, that's the engine. We have to maintain it. We have to make sure their health is taken care. Can you please talk about
Yeah,
minimum
sure.
exercise recommendation?
Sure. I just want to start out with saying that, any exercise is better than no exercise at all. So, unfortunately, we have to say that in our population, there are people who do not do any exercise. So, I don't want to put them off by saying, okay, you have to do this many amount of minutes or hours a day. Of course, these are all recommendations. But even if you're going to do an exercise of 5 minutes a day, as opposed to not doing anything, even that has shown benefits, remarkable benefits to your health. Okay. So
Something
having
is better
said
than
that,
nothing.
absolutely, yeah. But having said that, of course, there are recommendations for optimum utilization and optimum work that can benefit your health. So let's start with children, very young children. As a rule of thumb, I just say that kids need to be playing, which they are not nowadays. They should be playing at least 60 minutes per day. Okay, at least 60 minutes per day. But as we grow, older, the recommendation goes down to about perhaps 150 minutes, minimum about 150 minutes per week. 150 minutes is what, 2 hours, 2.5 hours per week. So that probably averages to half an hour a day. If we can do that, that'll be great. And I would recommend that would be the same to the elderly people as well. Probably not. We are talking about minimum requirements. So this is just the duration itself. What is ideal, of course, in adults is to combine it with aerobic and strength training. Okay, so doing an aerobic session every day is probably not advisable because that may put a lot of strain on your muscles and joints. So if you combine it with strength training on alternate days, that actually improves your bone strength as well, your muscle strength as well. And of course, as we grow older, we're losing our bone mass and muscle mass. So some strength training has to be incorporated so that our bones and muscles will be healthy later on in life as well.
Yeah, and I think that's well said. When we talk about children, unfortunately, I don't think they are getting the 60 minutes of minimum recommendation.
Absolutely.
And then we used to get it. I used to get that during my childhood days, and I still continue to follow that because exercise keeps me happy. I just finished a cycle ride as part of the ALERTATHON, and I wanted to walk, I wanted to cycle and run. It gives a lot of happiness. I also felt that every day if I exercise, I tend to sleep more. The days I don't exercise, I feel very groggy and sluggish. And it's amazing that these recommendations are very scientifically
very true. Very true.
And doctor, when we talk about exercises, what is considered to be an exercise? Because at a very small and younger age, there is a concept of free play, right? So they just kind of random tag games or climbing up and down. I remember during my childhood going up and plucking mangoes and fruits. And so, what is considered to be an exercise?
Yeah. See, any activity, any activity is exercise apart from sleeping or sitting and in front of the telly. If for children, I think you have to let them be rather than saying do this or do that. You just have to find out what they enjoy and running around, catching each other, climbing trees. Everything is fantastic, and they're more likely to comply if they enjoy what they're doing. So yeah, so just try to. I think you have to give them options to explore different things and find out what they like, and then for them to have a lifelong liking to exercise. It is better to introduce them to various types rather than making them just play cricket, and you want them to be a good cricket player, but if you don't expose them to other sports, they're more likely to burn out. This is just an example. So expose the kids to different play and games, and they'll pick their own sport which they will like, and they'll give up on some of them, and they'll have a healthy attitude towards play and sport. That is what you should try and do for children.
That's a very well said statement. A healthy attitude for sports, because we have seen time and again that those who are involved in sports, they develop a positive attitude, good teamwork, a great spirit and camaraderie, respect
Absolutely.
for the sport, respect for the game, and to the body. I think it's definitely a serious thing that every adult child parents to consider and give this as a recommendation. I just wanted to read a comment that I
Absolutely.
received from one of the viewers. He said, "Hi, coach. Hi, doctor. Thanks for the session." So let's thank Tanish
All
for
right.
sending these notes to us. So now, when we talk about, so these are some minimal exercise recommendations. Now, what is different when somebody falls in love with a very specific sport like running, right? So, and I'm
Right.
sure ALERTATHON is all about endurance sports. We encourage people to move because movement is a privilege, and you can walk, you can run and cycle. So, what exactly is the sport specific training? And if you can highlight the difference between general exercising for health and then general exercising specific to a particular sport, doctor.
Right. So, to be honest, the division is there's not much of a clear division. So, for any sports, you need a basic fitness, both cardiorespiratory fitness and musculoskeletal fitness. So, that is your solid foundation, and that you need to have. And after that, of course, you can specialize. If you're playing football, you have a specific kind of training for football. Cricketer would be different. If you're into running, that's different. Swimming, that would be different. Of course, since you asked about running, usually, the recommended training pattern for running, what I would say is, first thing I would say for anybody starting to run, I would advise is don't run every day. Okay, so that is based on sound scientific principles. They actually looked at people who ran every day versus people who ran thrice a week, and they didn't really make a difference in terms of how they perform. On the contrary, and people who ran long distances every day were likely to have overuse injuries over a period of time.
I'm
So
just
this,
going to stop you for a
yeah,
minute now.
please.
When we see a function, I watched a beautiful video from Smithsonian Laboratory. So this is all about scientifically proving that our human body is designed to run. As children, we never laid any restrictions for the children to run. We never, and of course, some of the old people who are overly caring, or even parents overly caring, that they would say that, okay, don't run, don't climb, don't, you might hurt, your bone will be kind
Yes.
of injured. But aren't we supposed to be running throughout our life? Or the advice that you're giving in terms of, let's say, 2 days a week or 3 days a week, is it for people who are starting new at the older age, or is it for everybody?
Uh, See, that is a good question. But generally, see, when you take runners, so there are runners who just run irrespective of what you say, because that is their passion, and they, as you know, there are people who run hundreds of kilometers, thousands of kilometers, and if you ask them, "Are you running for health?" the answer is necessarily no. There are other reasons why they're running it, because it gives them a sense of well-being, a sense of accomplishment. But if a runner is asking me, how much should I run for health, for optimal health, then the advice is different. So when I say, you are better off running 3 times a day rather than every day, combine some strength training in alternate days, I am just advising for optimum health. Yeah. So as far as your question is concerned, people who do run every day do run the risk of developing overuse injuries, because every time it does not just running, even if you're weight training every day, or if you're running every day, every day, if you're swimming every day, what's happening is you're developing micro tears in the muscles that you're using. So, and you need about a minimum of 24 hours for them to repair. Micro tears in itself, it's not a bad thing. So that is how the musculoskeletal endurance evolves. They repair and they become much stronger, but you have to give them that rest of 24 hours in between. So that is the logic between asking people to rest. So when you're running and in between, if you're cycling or strength training, you're using a different group of muscles. The original group of muscles are being rested. So that is the kind of scientific basis for that advice.
What is the role of cross training in terms of packaging?
Yes.
Let's say when we talk about strength training and combining cardiovascular fitness and muscular fitness, I think this is the smartest thing to do, because you can't be overly obsessed with one aspect of fitness. The role of cross training seem to have a lot of benefits. I have benefited. I've gone through multiple phases of injuries, switched to cycling, and the summer months I used to enjoy swimming. And so, what exactly the cross training does to our body, doctor?
Yeah, so cross training is a very simple and a wonderful concept, especially for someone like me who treats. If I give an example, I have someone with a knee injury who's not able to run, and he comes with a problem. And if obviously the knee itself needs resting. But if I ask him to run, or if I ask him to stop his running, then of course his knee will get better, but he'll gradually lose his cardiorespiratory fitness. So that's a very important concept in treating patients. So my job is, yes, I have to give him the rest required for the knee, but at the same time, I don't want him to lose his cardiorespiratory fitness. So I would encourage him to do something like swimming or cycling, which doesn't put so much strain on the knee. So thereby he's giving rest, he's resting the knee as well as he's maintaining his cardiorespiratory fitness. So when his knee recovers, it's actually a smooth transition to go back to his sport. So that is, in the context of an injury. Even otherwise, if you are a regular runner, on days that you're not running, you do other things, like running and cycling and strength training. So any training that you're doing apart from your chosen thing, where you're relatively resting your muscles, can be called as cross training.
Okay. Now, I had a very interesting conversation with the bicycle mayors associated with Bikes Foundations. It's a concept. Basically, they're working towards transforming the urban transportation, in a much greener, cleaner way. So use cycling as a means to commute. And I remember during our childhood, we used to cycle for fun, and nowadays there's no safe place for us to have that kind of a. So the exercise is can I say that to layman's language, an exercise is a designated time where you really focus on developing or maintaining certain aspects of our body system? Or if I'm cycling to work, if I'm walking to catch a train, or even walking 7 floors up and down just to go to my car park, uh, do they also consider you consider them also as exercises? Is exercise, does it really mean that only a certain designated time I need to allocate time and do some movement, and that is considered as exercise?
Not at all. I mean, see, whatever works for people, exercise prescription. When I ask my patients, to do a certain exercise every day, I need to assess first of all what are their interests are. If somebody is struggling to fit in, somebody has to leave early to work and comes home late. It's not going to work for him if you tell him you have to, do exercise, just sit in one place and do it. You have to incorporate that, like you suggested, cycling to work, or getting off a bus or a train maybe 5 kilometers ahead of their workplace and walking it. If they have a gym close to the workplace, so whatever works for individual people, the most important thing is they have to be active. And it doesn't necessarily mean that you have to do it at one set, at one go. You can even distribute it throughout the day. So I think it's the cumulative number of minutes you spend rather than how or in what way you do that is important for optimal health.
No, so I think that's the movement throughout the day is much more beneficial than I personally experienced it. the days I finish my workout early in the morning and then continue that routine, and then the rest of the day I'm sitting and not moving, busy working or doing something other than exercising, it has a different effect on the body.
Absolutely,
But at the
yeah.
same time, taking timely breaks every 1 hour or 2 hours, doing maybe 10 jumping jacks or some push-ups, or if you have a small dumbbell, flexing the muscles, it seems to be definitely
Yeah, it keeps you
beneficial.
perked up through the day.
Exactly, charged up, right? Or sometimes if I'm feeling very sleepy in the afternoon, I try to take a nap, and then when I wake up and I feel fresh, I'll go for just a 1 kilometer run, a 10 minutes run, and come back, and it feels really good. So now, one question related to preserving the muscle mass, and I think this has been a very challenging topic. As we age, our metabolism go down, and our hormonal system is slowly deteriorating. I won't say dying; it's a scary word. I said that. Now, how can anybody ensure that they are preserving the muscles and also the bone mineral density? Because the BMD, it's one factor that determines the strength of the bones, right? As we age, I have to exercise, continuously exercise, so that we maintain our whatever muscles and bone that we have grown over a period of time. How can anybody ensure that they're not losing their muscle density and BMD?
Yeah, so that's an excellent question. So just to understand how our bone mineral density works, let's start with the bones first. We are actually accumulating bone mineral right from our childhood. In fact, the maximum mineral deposition in our bones happens when we are children or around adolescent time, and it peaks, and then from 30 years of age we are actually losing mineral from our bone. So that's and so if you want to really especially for children, if they are listening, if you want to really optimize your bone mineral density, the time to do is when you at childhood. That is the time when you ensure that you are taking adequate calcium rich foods like milk, cheese, butter, and so on, and doing exercise, impact exercise that strengthen your bone. Do not lose that opportunity, because that is the thing. It's like a bank. You're building up your bone mineral at that time. And say after 30s, when you start losing your mineral, of course you can maintain them, you can minimize the losses, again by having a healthy diet and doing exercises, specific exercises, to the bones, like running and jumping and squats and playing tennis, what we call as impact exercise. So you have to load the bone to make it stronger. An interesting thing you may know is, people who are only cycling,
Yeah.
people who are only cycling have very low bone mineral density,
Okay.
because they are not, or people who are only swimming, not doing anything else, they have very low bone mineral density because they are not actually loading the bone.
Yeah,
That's all.
I just read an interesting research report on how the martial arts sports people, and especially the kung fu and karates,
Yeah,
their bone mineral density is one of the highest because they are
absolutely.
into powerful movement and hitting and punching, and it's amazing how strong their bones are.
Definitely,
So
no
they're
surprise there. And one particular thing is, what they found with bones, it should be a multi-directional exercise, which basically means that if you're lunging, you do lunges in all directions.
correct.
Like when you're playing tennis, you're moving in all directions. So what the bone is responding is to stress in different directions, and it becomes much stronger.
Okay.
So that's what you should. Yeah.
So the now you talked about the stress factor, right? You're basically loading the muscle, loading the bone so that they respond by strengthening. You overload them, they break. Now, how does anybody know that what is the optimal amount of stressing that needs to be done so that there is a development that is happening? Because we also have this concept of hypertrophy, because if you really see the average gym goers, they are inspired by some superheroes. I remember those days. Arnold Schwarzenegger used to really stand, kind of Sylvester Stallone and Arnold, with big muscles and six packs, and even if you see the gyms, you will see all this kind of images to lure you, right? Very fit and athletic and muscular people. Now that comes with a lot of discipline, and of course we are not going to talk about the enhancers, the drug enhancers. That's a complicated subject by itself. Now, for somebody, they generally say that your body is like a temple. You have to worship it. You need to have the discipline to develop, and even bodybuilding is also a discipline by itself, right?
Yes.
Now, how do you? What is your advice for people who are having the aspiration to go to a gym to build a body like that? Is it something necessary to have that kind of an aspiration, or is it a realistic aspiration for an average person to have?
Yeah. So, I mean, this is something that I asked quite often. I get asked quite often. I don't think there's anything wrong in trying to look like somebody who you admire. See, as long as you are doing it within safe limits. So it is. I mean, yes, you touched upon performance enhancers. So that is like the red line. So sometimes gym goers who want to develop their body, it is important not to fall into that that compartment of going, it's like a vicious cycle. You develop good body and you should know the limit. Then you fall into this vicious cycle where I want to do more and more, and that is fine too. But the minute you start thinking that, okay, I'm not happy with this, I have to take supplements, or I have to give myself some medication to do more and more, that is when you are crossing a red line, and that is the point that you're better off not reaching at all. But within that limit, for most people, I mean, very few people go along that route. For most people, yes, developing good musculature, good bone strength training, is good and it's helpful to them. And like you said before, it is important to not just do that alone, do some aerobic training as well. Have a balanced fitness is what I would recommend.
Now, the balance is absolutely important, and I'm from the Ace Fitness community, right? So I'm a certified personal trainer, and I've been studying the integrated fitness training model. So it clearly lays out the structure. You have the cardiorespiratory training, you have the muscular training, and then you have a what is called as a base phase, and then fitness phase, and then performance phase, as far as the cardiovascular training is concerned. And then your muscular training is concerned, you basically talk about the functional movement, and then load, speed, and power. If you see that the foundation, the base, the functional movement becomes absolutely important, it kind of reinforces the understanding that your foundation is absolutely important. In fact, within my academy, I launched a program called Reconstruct the Foundation. Let's all travel back in time and see if we can fix our posture, if we can fix our functional movement ability, the range of motion, the joint mobility, the flexibility of your muscle. I think that's really an important factor here. So now, when you assess the sports people who come to you for treatment, do you see a problem in terms of a lack of understanding on these concepts? Do you see that more and more the fitness enthusiasts are jumping into an extreme endurance sports which they are actually not ready for? And how will they know that they are ready or not? How do they even know? I'm at the start line, I want to run, I want to cycle. How will I know that I'm ready to jump into this game?
Yeah. See, let me start with the context that you started. Patients presenting to me, more often than not, when they present to me, they already know that they have a problem. So the body has told them that, you've done too much or too soon. And so it's actually easy for me to, to explain to them and convince them. And what I do is I get a detailed history of what their intentions are, what the training plan is, and more often than not, I can tell them that, okay, this is what went wrong, and at this point, you shouldn't have gotten into what you're doing, as fast as you should have. You shouldn't have done so many miles here, and that is what has led to it. And more often, leave the acute injuries. When you look at overuse injuries, it's not something that happened in a day or in 1 hour or in one instant. This is what they have accumulated over hours and days and months. So it is often, quite easy to go back to the training schedule and pick out, where they have done wrong. So since they already have a problem when they come to me, they are more receptive to what I have to say. to say, okay, you have to modify this. This is too soon. You're not ready for the next race that you're planning. Give it a break. Maybe a few months. You may be ready 6 months down the line or 3 months down the line. So that is how we have a discussion, and that gives me an opportunity to explain to them about periodization of exercise, how they should have a balanced fitness, and so on and so forth.
Okay. Now, I that kind of brings up an important point that we generally look at as sports doctors as somebody who can provide a solution to me after something has happened. Now, for me, the context of approaching sports doctors should change and transform. That even before you start something,
True.
go for a consultation to check and assess. Because as coaches, I have a network of sports physios, so we work very together to start with the FMS, your functional movement screening, even before you start something. Because most often I get calls from my clients saying that, okay, I want to improve my timing, and I want to increase my distance, and I want to go run an ultra marathon. But okay, let's talk about your foundation. So let's check your posture. Let's check whether your range of motion is good. Do you have any tightness? Do you have any muscular imbalances? I somehow feel that the sports doctors, the concept is growing in India. There are many fine doctors like you who have come with a lot of experience dealing with sports people. And I would like to make a statement that just if you're an absolute beginner, or if you're kind of just started something, go for an evaluation, right? So that will reveal a lot of. It's like showing the mirror in front of who's that person, and I see a sports doctor can do that. So now I would like to ask one question coming from Suresh Rasapan. He has asked a question. Sometimes I feel tired in running time. How should I avoid?
See, of course, there are many reasons. One is, if you're not tired, you're not running enough. That is the simplest way of saying it. So tiredness is a normal side effect of any exercise or running. But he can look into other issues, like whether he is hydrating himself properly, whether he's has enough fuel stores in him. It all depends on how much he's running. If it's just running 5K or 10K, then he can just do replenish these sources afterwards. But if it's longer duration, of course, he has to think about replenishing them during the course of a run. So I think this is the simplest way of explaining this question.
Okay,
I think.
so it's complex, right? Because
Yeah.
The reason for getting tired could be many reasons. But sometimes I've also seen, especially in women in the middle-aged years, when they come and run, this tiredness seem to be very common because of, let's say, the red blood cell counts,
True.
and the oxygen-related issue or breathing-related issue, or maybe they're overdoing. And
Yeah.
can you also talk about, in fact, that question is something that I've written down. I wanted to ask you that when it comes to women and men, uh, how do you differentiate the need for exercise? Now, I personally feel that there is no distinction, but as a doctor, what do you see as the difference between the exercise recommendation for men versus women, or is it like
Yeah.
something same for everybody?
Yeah, I mean, you're quite right. In terms of recommendation, I don't really differentiate between how much they do and what they should do or shouldn't do. But they do have some, physiologically, if you compare men to women, lots of studies have been done. They do have some advantages and disadvantages in terms of how they perform in different sports. For example, in sprints, in short distance sprints, men always have an advantage over women because they're of bigger build, muscles are bigger, they can store more glycogen. Whereas in swimming, women have an advantage because of body fat distribution. They are likely to be, floating better than men. So there are some differences, basic differences. But as such, exercise recommendations, I wouldn't differentiate. But this is for regular people. But when we go into, we should always differentiate when we're giving advice. We should make a distinction between elite athletes and regular people, because we don't want to put off the regular people from exercising by saying these things. So if you look at elite endurance athletes in women, they do have some specific problems. compared to men. These are women who are running huge distances. They're clocking a lot of mileage over, weeks and months. They do have a triad called the female athlete triad, which unfortunately even, ultra marathon runners, women runners around the world, they are not really aware of it. There was a questionnaire in one of these ultra marathon runs, and perhaps about 60 to 70% of the women participating were not aware of the female athlete triad. So it's very important for this message to go out to that community. So as you know, long distance runs like marathons and ultra marathons put a lot of strain on energy. So after a run, you end up energy deficient. It's impossible to keep up with that energy loss. So it is important for both men and women to replenish those energies when they get depleted. In women particularly, they do cause other issues like, menstrual issues, because when you're completely energy depleted, that suppresses the hormonal axis, and that can lead to menstrual issues. And that in turn can affect your bone mass, and they are more likely to suffer more of osteoporosis and stress fractures. So it becomes, once they fall into that triad, it becomes really difficult to treat them. It is treatable, definitely treatable. One first thing is to recognize that and seek a specialist, and it would take a multidisciplinary approach. One would be a sports doctor, a gynecologist, and a dietitian. And the most important thing there would be to replenish their dietary energy levels, basically, so they're having adequate diets, and give appropriate rest if they have developed stress fractures, and make sure that their menstrual irregularities are treated. So that is a triad that is peculiar to women. So that is one thing that I would advise elite ultra running women. But otherwise, I think more or less, the recommendations for exercises probably are not very different between men and women.
Okay, now that brings in another important aspect of when considering the health of women. During the menopause period in the monthly cycle, there's again different logic. All this, let's say, sanitary napkin advertisements, they say that, okay, you can exercise, you can jump, you can hop. But most of the old style traditional, whatever the motherly advice that we, all, I know my sister would get it, and of course my wife and little daughter. So they all get a conflicting recommendations. Are they supposed to run, walk, exercise, go out to play? If it's like teenage years girls, younger adults we are talking about. If not, can they do weightlifting? Can they do kind of little dumbbells, or some kind of an aerobic exercise? So there is no consistent message during this 3 to 5 days menopause. It's a natural cycle. Can women exercise? If they are allowed to exercise, to what extent they can exercise?
Yeah, I don't think you have to particularly. I necessarily do not advise them to do anything different from what they are. They themselves personally may find it difficult to do. They're likely to be more tired because it's energy depleting to do. Perhaps go for an endurance run during those times. It's completely personal. I don't say do this, do that. If they're finding it difficult, then they can cut down on it or minimize it or substitute and one exercise to the other. But I don't think there's any scientific basis to advise one is preferential to the other. It's only personal comfort and discomfort.
Okay, because it's very difficult to align a performance day, right? Let's say if there is a race day which is like 14th of January, you can't change the menstrual cycle. You have to go and perform on that day. And I've seen quite a successful. I'm connected with a lot of endurance and women runners. Even with my academy, I coach a lot of women. They never seem to be complaining. But I think the awareness is the key here. There is education, and the awareness is the key now.
Yeah, and I see a lot of women going for menstrual cups. People who are into endurance running. But I'm not a specialist. I'm going out of my area of specialty here. But this is something that I've seen, which is easier for them to compete in sports. But that is something that they have to discuss with their gynecologist and try it out themselves. I'm not a specialist to advise on that.
So I'd like to focus on pain. Before we jump into the subject, I'd like to take one question from Suresh Rasapan. His question is, barefoot running, is it good or bad?
Yeah, there's a short answer and a long answer to it. The short answer is it's bad, in my opinion, and when I looked at literature. Let me just explain the long answer. Barefoot running, of course, it's taken off, recently in the last few years. A lot of interest initially, and a lot of tests were done in the lab situation, where people are made to run in the lab on force plates. They were looking at how the forces were going up your joints and all that. And, it looked fantastic. They calculated that, you were very efficient when you were running barefooted, your gait changed, you were doing more of a forefoot strike than heel strike. And that was good. And the reaction forces on your knee joints were less and ankles were less. So people thought, this is fantastic. We were not going to see any of those overuse problems that we used to see before. But as it became more popular and more popular as sports physicians and clinicians, even I had started to see a lot of problems with overuse injuries like stress fractures. Okay, so it's people thinking that barefoot running is a panacea for everything. Suddenly jumped to barefoot running from short running, and they started developing these stress fractures. And even if you look at literature, people who transitioned within a period of 3 months had about 10 to 15% of stress fractures in the feet. And even in people who took about a year to transition also had problems. So, of course, in spite of that, there are very dogmatic and orthodox barefoot runners who have done it successfully. And, but most of those have done it over a period of, I would say, months and years. So normally, if someone asks me a straightforward question like this, is it good or bad? I'd say bad, don't try it. My normal advice is whatever you've been doing throughout your childhood, running is something that comes naturally. You don't tell children to do this, do that, put your foot like that. You've been doing it naturally. And if it's working for you, then there's nothing to worry about. Of course, if you run into problems, then we can look at, if you're pronating or supinating, this and that. But normal people don't change your running pattern. If you're happy, if it's working for you, just stick with it. If shoes is what makes you run properly, stick with it. If you have to go into barefoot running, I would advise you not to. But if you really, really have to, then please do it over months and years rather than weeks or months.
Yeah, I think that's fairly very fantastic advice. Uh, the problem is with our human mind and aspiration. All of us want to get better and better, stronger, faster. So these are things that we enjoy doing throughout our life. And of course, as we get into this middle age, there is a conflict because you kind of our growth, personal growth, kind of comes to a saturation, and suddenly you feel that you're, and then there's a lot of hope that comes in the form of, okay, I can jump into endurance rope. And I see a lot of people performing at a very middle. They start at 35 and they go up to 50. They're scaling, they're getting into qualifying into Boston and other, let's say, some of these very iconic events. And then of course we also see people who are performing better because they are following certain things, that absolutely may not work for you personally, because our personal journey is our personal journey. We cannot mix and match. But yes, it's nothing wrong in experimenting, but don't overdoing is always a problem.
Yes,
So coming
yes.
back to what I wanted to ask you, so when we talk about pain, we always talk about chronic pain and acute pain due to injury or due to posture or due to age. uh, Now, what exactly is the how can I know the pain is an acute one or chronic one?
Yeah, see, a lot of people ask this question, they go for a run and they have pain. Should they worry about this pain or not? At a very basic level, if you've gone for a run after not running for several months, you are like the other person who asks, I do feel tired. And if they're doing it for the first time, that's a very normal thing. You do feel tired and your muscles do get sore. And, most runners would have heard of about DOMS, what we call as delayed onset muscle soreness. That's as the name, as the acronym describes itself. It's muscle pain that comes after unaccustomed activity. And it comes not just with running. If you're lifting something, all of a sudden, yeah, you will get pain after a day or two, which it should settle down. So general advice, any pain, and this pain is generalized, which is usually spread out throughout your muscle area or throughout the body. Any pain that is lasting perhaps more than 10 days and it's localized, if you're able to put a finger and say that this is where it's hurting, and that's the kind of pain that's probably you need to look into. You can't ignore that. It's persisting perhaps week after week, more than 2-3 weeks, and it's localized and not generalized. Then I think it makes sense to get it looked into. And of course, the longer it lasts, you call it as chronic pain. And if it gets better, then it would have been acute.
Yeah, I was listening to a podcast yesterday and they're talking about the movement bubble, right? As we are children, the bubble is really large. Our freedom of movement is exponential and there's no limit to that. But once we are injured, we are confining ourselves to a smaller bubble and then we don't move. When we don't
Very
move,
true.
and the range of motion issues and the muscles become tight, and of course that leads to further shrinking of this movement bubble, right? Now, what is your advice to people who are confined to themselves,
Yeah,
saying
yeah,
that, no, I cannot move, if I move, it's painful.
yeah.
But actually, movement is the answer for them,
Correct, correct.
right? How do you help
See,
such people?
I'm actually glad you asked this question, because this is, if there's one message that I want to get out to the general community, is this. Okay, see, all too often, either the society and unfortunately some of my own colleagues, orthopedic colleagues, they propagate this myth amongst the general public. They say, after a certain age you should stop sitting on the floor, you don't do this, don't climb stairs, don't go for a walk, your knee arthritis will get better. Unfortunately, all this is not true, and unfortunately most of it we have brought it upon ourselves. Like you rightly said, when we are a child, we're freely moving about. Nobody's saying don't do this, don't do that. As we grow up, and we are adopting a certain, if you can call it, a Western lifestyle, as opposed to what was an Indian lifestyle in the past, where we are where we were comfortable with doing activities at a floor level. But of course, we got restricted to sitting in a chair and all that. And inadvertently, as we grow older, we are losing a range of movement in the knee joints and the hip joints and all that. And that is definitely not good. And it's something that it's very difficult to regain after. And I have a lot of patients who have been advised and who come back and ask me and are surprised when I tell them, yes, you can go for a walk. Yes, you can sit down and on your floor and do your puja. Yes, you can do yoga. And they're actually surprised because they have been advised not to do
Not to
this.
do.
They have been advised that this is not good for the joint. One thing is good for a joint is movement. The only exception is being, if you had a major injury or if you had major surgery and if your surgeon has said don't move, or if your limb is in a cast that is preventing your movement. Those are the only exceptions. Anything else, it's always good to move. And 99% of the time, I tell them, please move and you will get better, and they do get better.
No, it's a fantastic statement, right? So you move better and you get better.
Yeah.
Now, I always wondering it's kind of a puzzle when we talk about musculoskeletal health and food and nutrition. And then, of course, there is also this discussion around how much calcium to have, how much multivitamins to have, and also how much protein to have. Okay, we can spend the next few minutes just talking about the relationship between food and musculoskeletal health. I think it'll be great for everybody viewing
Yeah.
this show today.
Right. So, see, of course, this advice has to be categorized between, advice for general health, general public, who just doing optimum exercise for general health. Of course, the advice will be slightly different for endurance athletes and so on. So, talking about, first thing you said is calcium. Like we've touched upon, it's very important component of bone metabolism, and it is also important for muscle functioning, and several other important functions are attributed to it. So it is important to have a regular calcium intake right from childhood, especially in childhood, and peri-adolescent area where, most of it is helpful in building the bone there. So the average recommendation in that period is, is about 1,000 to 1,200 milligrams per day. You're always better off taking it naturally rather than as supplements. Especially for children, I wouldn't recommend giving supplements. Make sure that amount of calcium is incorporated in their foods, especially dairy foods are a rich source of calcium. And of course, as we grow older, we are losing bone mass, and exercise is something that will help us to strengthen our bones. We touched upon that. And as we get older and older, people will be taking calcium supplements. Doctors prescribe calcium supplements, so on and so forth. And my own worry is that some people take these calcium supplements on their own just because they got it somewhere and somebody gifted them a box of calcium supplements from abroad.
I never received calcium supplements as gifts.
I know. You're probably better off. What I would say is, say, for example, a 60 or 70-year-old comes to me and asks, I'm taking calcium supplements. Is there any harm in it? I would suggest that they check their blood calcium and vitamin D levels, because sometimes you can go overboard on it and that can be really detrimental to your health. So people who are on calcium supplements, again, the recommended calcium supplement, if you have a deficiency, is again about 1,000 grams a day, 1,000 milligrams a day. But the best way to know is check your blood levels, calcium and vitamin D levels. If you're deficient, yes, you take supplements, ask your doctor for it. He'll be happy to prescribe it. But if you're not, if you're normal and if you're on the higher level, you're better off avoiding it. So generally, I'm not a great fan of giving supplements until there is proof for a blood test that tells me that they have deficiency, and that goes for other vitamins too. So what is more important to have is to have them naturally balanced diet, and that is the best way to go forward. And that is what I would recommend for athletes too. I generally don't recommend any supplements or anything like that. Have a balanced diet, have a lot of vegetables, natural foods, and that is going to have more than what you actually need. So that'll be perfect.
Go natural.
Go natural, yes. You can't go wrong with that. Then moving on to energy, what kind of energy? So, protein, the normal advice about 1 gram per kilo per day. Carbohydrate is probably, 10 times more than that. So so there are three main, just to keep it basic, three main energy sources for us. One is carbohydrate, the other is fat, the other one is protein. Most of our energy comes from fat and carbohydrate, perhaps 80 to 90% from carbohydrate, the 85%, say 15%, maybe 13% from fat, only about 4% from protein. Because protein is actually muscle structure. We don't have stores for protein. When the body is depleted, say in prolonged starvation of carbs and fat, only then it starts attacking the protein as an energy source, because protein is used for building muscle, other things. So predominantly carb is even for a marathon runner, 85% of their energy source comes from carbohydrate. Very well-trained athletes are able to use fat sources preferentially, because most of us carry fat, and it helps when you're running a marathon or an ultra marathon if you can preferentially use fat as an energy source apart from carbohydrate. So I would say, carbohydrate is the most important fuel for you, whether you're a normal person, optimally exercising person, or if you're an endurance athlete. If you want, of course, endurance athletes do special training and other things. So in the hope that they would preferentially use their fat stores. And of course, people have tried different things. There's a lot of recent interest in high fat and low carbohydrate diets, and some studies have been done on that. And what they found is, yes, if you take a predominantly high fat and low carbohydrate diet, you do switch your metabolism from preferentially using your fat metabolism, but there is a cost for that. The cost is, you're not able to perform at the same intensity as that when you're taking carbohydrate, and you're requiring more oxygen to do fat metabolism than carbohydrate metabolism.
Okay. No,
So
it's
there is a
certainly a complex topic, and
yes, yes,
my general advice to my clients and to telling to myself is don't jump into any type of diet,
absolutely,
because it is beneficial to somebody else. Always, especially when it comes to supplements, you need to be extra careful about it. A qualified dietitian or a doctor like you could prescribe the right dose of supplements that are needed, essential for our body, because supplemental overdose is also another complicated issue that
absolutely.
everybody deals with. So doctor, I'm really excited to see that I feel like we've just warmed up and we can go on for
Yeah,
a lot
yeah,
of time. It's already over 1 hour. We have some questions pouring. I would like to read a couple of them.
sure.
When you say barefoot, what about the minimalist shoes like the
Yeah,
Vibrams? There is absolutely no offset. It's called a zero offset shoes. And then the second part of the question coming from Kishore Ranganathan is what is an ideal height to weight ratio for running? I'm 183 centimeter tall. How much should I ideally weigh to be a good runner? So it's both questions coming from the same persons.
right. So minimalistic running shoes like Vibrams, definite no, because in the US they have been sued for claiming things that they didn't, and they had paid out those suits because, again, a lot of people having a lot of problems with minimalistic shoes as well. So there's no reason for me to recommend those.
Okay, great.
Uh,
And height to weight ratio
See,
and
again, I wouldn't worry too much about it. Basically, you have to check your BMI for your height, and there are easy calculations to do that. I wouldn't say that you're short to run or you're too tall to run. If you're into running, by all means, get into it. But by and large, you find that, runners, as they keep running, they are thin, especially long distance runners, or more thinner, especially in their upper body compared to sprint runners, because sprint runners need a lot of glycogen in their muscles. They work more on developing huge muscles so that they can have huge stores of glycogen, and their muscles need anaerobic metabolism as well. So their body is an entirely different shift, whereas an endurance runner is quite happily doing aerobic metabolism. And as you run, your body morphology will change to adapt to your running. So I wouldn't worry too much about it.
yeah, I think the height to weight is an important factor, but that doesn't really talk about the muscle health, right? Because that's always been a problem. And then the lean mass is absolutely important.
Correct.
We're connecting back to the theme of this session on musculoskeletal fitness for exercise and sports. The lean mass is much more an important parameter than just measuring the height to weight
Absolutely,
combination.
just the
So
weight.
I have
Yeah.
one more question from Srini Vishwanathan. I have an injury in my sartorius muscle. I think that kind of runs through the quadriceps. And after doing a lot of physiotherapy, I got better, but it is still comes and goes during my running. Any advice?
Yeah. Yeah, it's difficult. You have to see a patient, get his history, and examine him. Just enumerate the principles. Hopefully, that will be of help to him. If it's coming and going, you have to focus on why it is coming. Maybe just look at the period before it comes. Are you doing more during that period? Are you just running longer? And if you're still in the part of a rehabilitation, my advice usually to my patients is, runners have a tendency to test the boundaries of pain. They'll do a few days of rehab, then they want to know if they get better. When I advise them, don't, just run 5 kilometers, they want to know, okay, I feel better. Let me try 7 kilometers to see if there's always a natural instinct to test, to see if the pain comes back. So my advice for them to keep well below that painful, say, if you're getting that pain, at about 7 kilometers of a run, just run 5 kilometers till you completely get better and rehabilitate. And then you slowly creep up to 7. So that is something that, he could focus on. But like I said, it's very difficult to give a specific advice without actually having a chat with him or examining.
Now, I just would like to recollect my first interaction with you, because I
Yeah.
came to you with a pain. And what I really admired about your approach is you took a piece of paper and started asking a lot of questions to know more about my activities and what I was doing, what really caused, what is the aspiration. And then, it was a very structured conversation without any time limit. That's something that I admired,
Yeah.
and which is also the most common problem that we find with some of these specialists. They're pressed for time, and then they kind of don't really invest that time. That's why I like this functional medicine, where the time spent is one hour
Yes.
and 1 hour 30 minutes kind of
Absolutely.
time.
Yeah.
But now, I think an advice, somebody having a chronic issue should have a proper root cause analysis done. And maybe I would advise this gentleman to talk to you, right? Apollo Hospitals, Dr. Praveen, to help you have a much better understanding of the problem. And I also have two. First question, it's more of a comment coming from Meera Kannan. I don't know if it's my wife, because the name sounds familiar. Amazing. Thank you so much, Dr. Praveen, for debunking the myths. And then the question
Glad to
for
be
her
of
is,
help.
yeah, is there a form of exercise that uses up, builds most of the important muscles?
Uh, I think most functional exercises, the most important muscles are the core muscles and the functional muscles. The simplest form of a functional exercise would be a squat or push-ups. Most of these muscles use multiple muscles groups. Those are the ones, you could, if you have to choose, you could preferentially choose those over a single muscle exercise like biceps or triceps. For generalized fitness, multifunctional exercise are perhaps better.
Okay, yeah, but I'm also a great fan of functional exercises which mimics your sport that we all
Yeah.
play and enjoy. It's fabulous. So I don't think I have any more questions. So I would like to basically spend the next 2 minutes just to wind up. And what I really liked about this session is we were able to kind of uh, go through from the beginning of understanding what the musculoskeletal system, and we touched upon little complex topics, but certainly the subject is exciting. And as I mentioned, it's just like, I have warmed up now and ready for more, but in the interest of time we have to really close it down. One message that I want to take out personally is, um, do not lose anything that we have built over a period of time. And as you rightly pointed out, the calcium deposit, the muscle, it's all deposits are happening, the bones are growing every single minute during our childhood time. And then suddenly one day we forget everything, we stop exercising because education becomes more priority, or earning becomes more priority, family becomes more priority. But I somehow feel that whatever we built, we should try to maintain them. The exercise that we do at an older age is more to retain everything that we gain, rather than kind of to get better and go faster. And of course, those aspirations are also important, but at the same time, there has to be some amount of sanity. Okay, so do not lose anything that you've gained. And if you are a small boy watching this, I don't know how many boys are allowed to watch such programs, especially on a prime weekday evening. But if you're a teenager, I think it's much more important, because there is going to be a lot of stresses that are going to be growing stresses in terms of education and commitment. Never miss an opportunity to exercise.
Very true.
So with,
Very
with
true.
that last note from my side, Dr. Praveen, would you like to say something in
Yeah.
general to everybody? Uh,
Yeah. See, first thing, I think this ALERTATHON and thing, I think you're doing a great job, especially teaching general public the art of CPR and all that. In fact, I would like to quote a certain study that was done in the context of running in a Boston Marathon. Of course, there are always runners who collapse, and what made a huge difference between their survival was a bystander providing them a CPR. So that kind of illustrates how important it is for general public to learn about these things. So, by popularizing all that, I think you're doing a fantastic job. And of course, it's been a great pleasure to discuss these things with you. It's always been a pleasure. And of course, there's a lot more to discuss and a lot more to impart the general public, and hopefully we'll have future opportunities to do that. And I've certainly enjoyed this evening interacting with you.
Thank you, Dr. Praveen. I would like to definitely credit Alert for taking this leadership role and pioneering the concept of education, right? So the basic, simple education. So we talked about exercise, science, and sports, and it's also into education. So this entire session is all about giving everybody an opportunity to learn a little bit. Alert has been doing a fabulous job, and I personally enjoy the interaction with you today. And thank you so much, and wish you all the best, Dr. Praveen.
All right. You too.
Thank you for a wonderful evening. I'm really feeling glad that we had this conversation today. Thank you.
Yeah. Same here. It's been a pleasure.